Inspect the abdomen with the patient lying supine with hands on by their side. You should inspect from the right side and have the patient empty their bladder. Inspect all 4 quadrants of the abdomen, ribs to the symphysis pubis, and the contours should be symmetrical. Assess the umbilicus, which should be midline and inverted. Ask the patient to raise their head to assess the abdominal muscles. You can detect any masses, hernias, or separation. Auscultate with the diaphragm for bowel sounds in all 4 quadrants. Then we'll auscultate with the bell for any bruits over the aorta, the renal arteries, the iliac arteries, and the femoral arteries. We'll percuss the right side of the abdomen and down and the left side of the abdomen and down, and then we'll try and percuss the liver. Right lung area down the midclavicular line until dullness is heard, and then we'll mark that. It's probably around the 5th intercostal space. That's the upper border of the liver. And then up the midclavicular line from the umbilical until dullness, that's the right costal margin, and mark that, and then we'll measure it, which should equal 6 to 12 centimeters. We'll percuss the stomach and the left upper quadrant, should hear tympany. And then we'll ask the patient to turn on the right side and assess the spleen. You should be able to find this around the 6th rib, lower mid-axillary, dullness in the 9th to 11th intercostal space. And then we'll percuss over the anterior axillary, which is the lowest intercostal space, and tympany. Have the patient take a deep breath, and you should still be able to hear tympany. Then we'll percuss the bladder. If the bladder is full, you'll hear dullness, empty, tympany. Then we'll lightly palpate with our fingertips all 4 quadrants, going in clockwise motion. Then we'll do deep palpation, 5 to 8 centimeters in all 4 areas. And then we'll palpate the liver, which is under the lower margin. Then the gallbladder, which is not usually palpable, it's below the liver. The spleen, put your left hand behind the back, 10th to 12th rib. Right hand in and up the axillary. Hold the deep breath, sometimes not palpable. Palpate the bladder, midline. Palpate the right kidney with your left hand below the patient's waist, other hand above it. Take a deep breath. And then you'll estimate the aortic pulsation with your thumb and index finger. Should be 2.5 to 4 centimeters. And then to test abdominal reflexes, you can use the wood side of a cotton tip and across the abdomen.